Hi guys, hope you're well. Super quick video on telephone consultations. I've done quite a bit of practice with people preparing for RCA, PLAB 2 and other consultation skills exams. And of course at the moment lots of consultations are being done on telephone. So I wanted to stress the importance of ICE in a telephone consult. People don't often seem to do an ICE, ideas, concerns, expectations, because I think on a telephone call people quite rarely are focused on a really thorough clinical history, trying to understand what the problem might be, doing a probably a more detailed clinical history than in a normal consultation because you can't see the patient, so you're doing lots more questions. But this is just a quick point to remind you that ICE is still really important. Whether someone's on a phone or on a video consult or face-to-face, understanding the patient's mind and what's going on here is really important, and sometimes probably more so on a telephone call. So remember, patients don't have the luxury of, or not the luxury, the kind of positiveness that you get from seeing somebody as a doctor or a clinician. So on a phone, they might be even more worried about certain things that they may not feel they can express they could have done if they were face to face. So sometimes you making the effort to ask those questions about their ideas, their concerns and expectations is really important, because it's maybe less likely to come out naturally than it would do if it's a normal face-to-face consultation. So make sure you make the effort of finding out what's going in their mind, because remember, ICE is about understanding issues in the mind, because unless you can pick those up, you can't handle those in the consult, and therefore the consultation may not be complete from a patient point of view. So ICE, ideas, concerns, expectations, on a telephone consultation may not be something that you do on a routine basis, but if you're doing it for an assessment, RCA, PLAB 2, something like that, make sure you take the time and the effort to get that as part of your history taking or as part of your data gathering. It's amazing how many things can come out that you're not expecting. And remember, because you're not face-to-face, you can't gauge things like body language. You can't gauge things like how they look at you when you ask a certain question. So you may not pick up cues that may make you ask certain things like worries, for example. You may not pick up that someone looks worried, or you get that hunch and they seem a bit worried, so you may go on to ask the question like you do it in face-to-face. So on a telephone consultation, really important to ask that question. Otherwise, as you know, with consultations, these things have a way of coming out a little bit later on in the consult. So when you're doing your management plan, then things like I'm worried about XYZ might come out, or do you think, doctor, I need a home visit, or I need antibiotics, or I need a referral. Remember, the whole point of ICE is that these things come out in the first half, some little ones in the background, so you can pick these things up and put them in place in terms of management alongside the clinical plan that you're hoping to do, whether that means coming in to see you or whatever it might be. Make sure ICE is part of your day together. Really hope this helps. ICE we work on quite a lot in our role play based courses, whether it's online, face-to-face or audios. Have a look at the website aroramedicaleducation.co.uk, whether you're preparing for RCA, PLAB 2 or any other clinical based exam like AKT, PLAB 1, MSRA or medical school exams, or any others that you're focusing on. But make sure you use the coupon Arora Video 10 to get 10% off anything on the website just for you haven't watched this video. So if you're preparing for PLAB 2 or you're recording for things like RCA at the moment, make sure, even on a telephone consultation and on a video consult, make sure you focus on ICE. It's not something that should be left behind just because it's a telephone consult. It's not only for face-to-face consultations. Ideas, concerns, expectations. Really hope this helps. #CampusWillPass. #I went with Arora. See you soon.